Good morning. So, I wanted to continue our conversation from last week about labs, which ones to ask for, even though they're not usually included in your annual. So, if you've ever been told that your labs are normal, why do you still feel bad? So, have you ever been told this? That your labs look absolutely normal, but you're exhausted, you're still gaining weight, you're not sleeping, and something just feels off? Here's the truth. Normal does not mean optimal. And if you don't understand that, you will continue to get dismissed while your body is quietly struggling. So today, I'm going to show you exactly why this happens and what your labs might actually be telling you. In conventional medicine, lab ranges are designed to detect disease. In functional medicine, we look for early dysfunction before it becomes a diagnosis. That's the difference. So let's break it down. What normal really means. When your doctor says your labs are normal, what they're really saying is you don't have a diagnosable disease yet. Let's just wait and see. Have you ever been told that? You don't want to wait and see. Lab ranges are based on large populations, many of whom are already unhealthy. So if you fall somewhere in that range, you're labeled fine. But that doesn't mean that your body is functioning optimally. Example 1, fasting insulin. You're often not given a range for this, or it's ignored completely. You could have an insulin at 12 or 15 and still be told everything is okay. But optimal, that's 2 to 6, and especially if you are in cancer prevention or you actually have a diagnosis, you want to be between 1 and 2 on that insulin, not a 12 or 15, because that means you're constantly feeding cancer cells. Anything higher equals that your body is already moving towards insulin resistance. So some symptoms that you might feel: stubborn weight gain, cravings, energy crashes, brain fog. So many times I'm going through a consult with a patient and I said, "Are you experiencing brain fog? Because I'm absolutely seeing it in your labs." And they're like, "Oh my gosh, how did you know?" There's patterns that I look for, and I absolutely can see that you are experiencing brain fog. Example number 2, your TSH, which is your thyroid. Most labs say anything under 4.5 or even 5 is normal, but optimal closer to 1.2. So if your TSH is a 3.8, you may be told that you're fine. They're not checking your full thyroid panel. So this is something that you have to be really careful on. You want to make sure that you're converting correctly. So you might be experiencing fatigue, hair thinning, weight gain, feeling cold all the time. Example number 3, vitamin D. You'll often hear, "Oh, you're good, you're at 30. No, you're not good at 30. Optimal is 60 to 80. I like to see my cancer patients 70 and above, especially my females. Postmenopause, menopause, perimenopause, you need to be at least 70 as well. So you do not want to be at risk for breast cancer. At lower levels, you may feel low energy, mood issues, a weakened immune system. If you're getting sick all the time, definitely check your vitamin D levels. All right, so let's look at the high sensitivity CRP, which is your inflammation marker. Conventional range says under 3 is fine. I want to see it under 1. If it's elevated even slightly, that means that your body is inflamed, and inflammation drives joint pain, fatigue, chronic disease like cancer, hormone imbalance. And let's talk about ferritin, which is your iron storage. This one gets missed all the time. You can be told that your iron is normal while your ferritin is off. Too low, fatigue, hair loss, weakness. Too high, inflammation, oxidative stress. There is a sweet spot, and most people are not in it. So let's talk about why you still feel bad. So here's what's happening. Your labs are being interpreted through a disease model, but your symptoms are coming from dysfunction. And dysfunction shows up before diagnosis, before labs go out of range, before doctors take action. Your body is speaking, your labs just aren't being read correctly. So what should you do? If this is you, do not ignore it. Remember, you're your best advocate. Start asking better questions. Educate yourself before you go in the doctor's office. What are my actual numbers? Not just normal. What are optimal ranges? Can we look deeper? Better yet, work with someone who understands how to interpret labs from a functional perspective. Because once you see the patterns, everything starts to make sense. That's what I look for. I'm looking at disease patterns. I'm looking at nutrient and vitamin deficiencies, imbalances. Always working to get the body back into a state of balance. You are not crazy, okay? I don't care what the doctor says. If he's trying to give you an antidepressant, you are not crazy. You're not making it up. And you are not fine just because your labs say so. There's always a reason that you feel the way that you do. You just have to look deeper. All right, so here's a few questions and answers. I'm sure if I have one, I have 10 of the same one. So let's go through it. Why don't doctors use optimal ranges? Because they are trained to diagnose and treat disease, not optimize your health. Remember, they're not in the business for prevention. 2, can I ask for my exact lab numbers? Absolutely, and yes, you should. Always review your own labs. When the nurse calls you and says, hey, Debbie, everything looks great. We'll see you back in a year for your annual. Ask, hey, can you email me those? Can you mail those to me? Get another set of eyes on those. Make sure that nothing is being missed. What's the difference between functional and conventional labs? Same labs, different interpretation. Remember, one is diagnosing, the other one is getting to the root cause of the issue, looking for imbalances. Can these issues be fixed naturally? In many cases, yes, through nutrition. I have a friend comes to me this morning, wants to know a good rheumatologist and endocrinologist to go to because she doesn't know what's happening with her body. I asked her, I said, do you want my advice? And immediately I said, you need to do an elimination diet. Cut everything out. 2 weeks, give your body a break, do some intermittent fasting, see if we can fix it through nutrition first, because a lot of times nutrition is the culprit. Lifestyle and targeted supplementation are other ways to fix it naturally. What symptoms should I pay attention to? Fatigue, weight changes, brain fog, poor sleep, hormone imbalance. How often should I test? About every 4 to 6 months, if you're actively working on your health. Remember, you cannot manage what you're not measuring. If you have any questions or you want me to run through the gamut with you and we go get some labs done, I look through everything and I create you a health plan, give me a call, 251-635-7477. You can email me anytime, Cindy@drcindyross.com. That's Cindy@drcindyross.com. Visit my website, lifewellnessforever.com. If you have any questions, I would love to work with you, and I hope you guys have a fantastic day.